I want the information to be accurate because why do we take so much effort and energy to put people in scrubs and make it all look real if we're going to tell things that are more melodramatic? Because people believe it. We want them to believe it, so we better be accurate. And so I wanted to know, how much do people really take from our shows?
From PHI Media, I'm Gordon Thane, and I'm joined by an award-winning TV writer, producer, showrunner, and medical doctor best known for his contributions to hit TV shows like ER, Law & Order SVU, and Designated Survivor. This is Dr. Neal Baer. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. For better or for worse, viewers tend to believe what they see and hear on TV. Knowing this, responsible storytellers go to great lengths to ensure medical accuracy in their writing and strive for authenticity in their portrayal of medical scenarios. Dr. Baer recounts pioneering storylines that introduced underrepresented characters from the 2S LGBTQIA+ community, and as a result, brought some unfamiliar issues to the forefront of TV, including introducing discussions around puberty blockers as early as 2006, long before these topics gained mainstream attention. As a pediatrician, he emphasized the nuanced debates surrounding medical treatments, pointing out the political versus medical perspectives involved. No matter what the issue he tackles is on his TV shows, he always leaned on the facts and how people are currently being impacted by an issue.
I did a lot of stories. I made Laura Innes's character gay in the last episode I did for ER in season 7 called Rescue Me. Maybe that's fulfilling my own issues because I came out in 2013 as gay, but I did a lot of, I made Ice-T's son gay. I did a lot of shows I did the first show about puberty blockers in like 2006 on SVU because I'm a pediatrician and I know they've been used for years. Now it's a huge discussion, as you know, and it's an interesting one. If I were doing a medical series, or I'm probably going to do some soon, I would bring this up because the law now in various places is that you can't use puberty blockers for kids who want to transition, but you can use them for cisgendered kids who have what we call precocious puberty. So we're saying on the one hand, wow, there are some side effects with puberty blockers if you're trans. But if you have a tumor of your pituitary gland and your daughter's 3 years old and menstruating and having breasts, we can stop it with puberty blockers. Are there side effects? Yes. Can we treat them? Yes. Can we prevent suicide? Yes. Do we have studies that show this? Yes. Did they argue in the Supreme Court about this? Yes. Did the Justice Alito bring up the Cass report, which has been shown to be a cherry-picked report that came out of England? Yes. Did he cite all the research in Lancet, New England Journal, JAMA that's been done by Alex Karoglian at Harvard? No. So it's a political issue, not a medical issue. But it's been suddenly the Supreme Court on the one hand says, we don't get into the medicine, but of course they are. So let's just be open about it and say it's a political issue. And here are the facts as best we know them. Now, the problem people have is that they want medicine to be definitive. They want COVID research to say the vaccine works, it doesn't work, and this is what happens. And guess what? The vaccine is protective. We know it keeps people out of the hospital because people aren't dying in massive numbers in the hospital because they got vaccinated. Are we doing research to look at the effect of the vaccines? Yes. Does it appear that the vaccines save many, 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 many more people than have side effects? Yes. Are there side effects with vaccines? Yes. Do we know about them? Yes. So we've got, RFK Jr. pushing, suddenly to not have polio vaccinations. It's like reckless and depraved. but it's his view. But if you talk to experts, but science is not definitive. We have the best data we have, but that makes for good discussions. What we know about measles is very different from what we know about COVID. We really know a lot about measles. We're still learning a lot about COVID. COVID, changes, and that's why we keep getting different strains or variants. Measles doesn't so much. So, are we prepared for H5N1? No, we're not prepared for bird flu. Well, are we starting to test milk? Yes. Does RFK Jr. say drink raw milk? Yes. So we have this issue. And what's really interesting about medical series is that Hollywood Health and Society, which is an organization out of USC's Annenberg School, gives writers free, accurate information on any health issue. So fortunately, the networks who air our shows, both the streamers and the broadcasters, know about Hollywood Health and Society. I've been working with them for almost 30 years, and they want data when we say something. So when I did an episode about measles and I say so many kids died this year, I didn't make up the number. I got it from the CDC, and NBC said, show us the data. I did. They say, okay. But we don't say vaccines cause autism. That was done on an ABC series maybe like 15 or 20 years ago. You're not going to see that now from doctors, because they look at the data. And we look at the best data we have, but we're always trying to do better. Why is cancer treatment? If you don't get vaccinated and you have cancer, are you going to take apricot seeds? Some people might, but a lot of people will then go to their doctors. And do we treat people with the same chemotherapy as we did 20 years ago? No, because it's going forward. Do we give the same treatment for HIV as we did in 1995? No, we give one pill now. We evolve because of science, but it's not definitive. Life isn't definitive. And so I try to make that clear.
This next part of the conversation shifts to the real-world impact of these shows, illustrated through episodes that tackle sensitive subjects. Dr. Baer recalls episodes where he portrayed euthanasia to explore ethical dilemmas, reflecting diverse viewpoints through the characters on screen. The groundbreaking medical cases and rare terminal diseases are used to challenge viewers' perceptions and invite deeper contemplation.
I did an episode that's Dick Wolf's favorite episode, I think, of SVU, which is called Mercy, with Judd Hirsch playing a pediatrician and Elizabeth Mitchell from Lost playing mother who euthanizes her baby who has Tay-Sachs. So as a writer, I can choose the worst genetic disease, always fatal, no matter what you do. That child will die by age 5, and they will lose all their milestones. It's horrible. And she euthanizes the baby, and then we get into it. And through our characters, this is another point to your question. Ice-T, Maloney, Mariska, the late wonderful Richard Belzer, all have different opinions about what Elizabeth Mitchell did and her pediatrician helping her. Maloney says, I would do it. I have 5 kids. I would never let my kids suffer like this. And I chose something where it's indisputable. That child will die. There's no miracle. Mariska's like, I don't know. I don't have a kid. Belzer's like, I'm an Orthodox Jew. It's up to God. Ice-T is like, I see everybody's side. So it's like, wow. This is not an easy question that we can just make a law and say, can't do this, can't do that. So I did something similar for Clooney when he left this season. I pitched an episode where he helps a mother euthanize her child who has adrenoleukodystrophy. I saw kids with this. Horrible. So I look for the complexities, and people want the simple answers. I understand that. What caused my child to have autism? As if autism is one thing. We say it's a spectrum, but even autism itself is so different. And when we look at something like Down syndrome, and we can test, and a woman can decide whether or not she wants to carry that child. Well, now in some states in the United States, we don't know if that child will be born and need institutionalization, or whether that child will be like the late Andrea Faye Friedman, who was on Life Goes On and did this fantastic episode of SVU, where she plays a young woman who's pregnant, and her mother comes in, the incredible Lois Smith, who is the oldest Tony winner, still on. I think she's an amazing actor, so I wanted to work with her. That's another thing, is like I choose actors I want to work with. I saw her in East of Eden with James Dean when she was very young, and I was like very taken with her. So it's like I wrote an episode for her. Should we abort fetuses with Down syndrome? We should ask that question. Is that a personal question for the mother? We don't know what the outcome is going to be. Some have amazing lives, like Andrea. She passed away a couple of years ago from Alzheimer's, which happens to people with Downs often at very young ages. But there are many who, are institutionalized and don't have, it's hard for us to know what kind of life they have because we're not in their head. So we try to raise these questions as opposed to avoiding them. I have my own personal beliefs, but I try to put out there the views, like I was telling you with the euthanasia story. So that's how I tell stories. I look for what's going on in the world.
In this next part of the conversation, Dr. Baer explains a collaborative process involved in crafting these narratives, mentioning consultations with various experts. These viewpoints ensure that the inclusion of multifaceted perspectives and accurate information adds depth to storylines like child marriages and the complexities of international relationships.
And then, for instance, on Designated Survivor, I happen to know that, well, I'm not going to give it away yet. I won't do it I won't do a spoiler alert. So we do an episode where it's on infrastructure. And so I asked myself, okay, how do we bring in a Saudi businessman? So we find out, we do research, we have consultants, Eric Schultz, who was Obama's deputy press secretary, Tim Naftali, who's a professor at Columbia in political science, who is an expert on Cold War, the CIA. And so I asked Eric, give us information about infrastructure. We find out that the Saudis have given the United States a lot of money to build infrastructure. So Kiefer talks to a Saudi businessman, and he comes in with a young woman who's about 14. And Kiefer has a daughter who's 12, and he relates to her, and he says, it's so nice that, you could be here. Do you travel with your dad a lot? He's not my dad. He's my husband. Reporters are there snapping pictures. Kiefer's like, whoa. So that turns into Kiefer's running for president. That turns into a big campaign issue. Is he going to address, what are we going to do about Saudi Arabia, who has child marriage? Well, I happen to know now that in the United States, we have child marriage. And only a few states have outlawed getting married under 18. I also found out doing research that Missouri is the child marriage capital of the United States because you only need one parent's permission. So dad can bring daughter there and get her married. So we added documentary footage. I'm always looking for new ways to tell stories too. So we added documentary footage on SVU through a character played by Ben Watson, who is the social media maven for Kiefer's character. So in one episode, Kiefer's like, why aren't people voting? And so we had our documentary filmmakers who were amazing, Christine O'Malley and Patrick Creedon, who've done the Taylor Swift and Brooke Shields documentary, and they've won awards for the documentary on the New York Times Crossword Puzzle Championships. They're amazing. So they went out and they interviewed people, and Ben shows Kiefer, here's why people are saying they're not voting. Well, they went out and found a young woman who got married at 13 in Kentucky. She was a cheerleader. Her boyfriend was 40. She was pregnant. He was going to get arrested for statutory rape, but he won't be arrested if he's her husband. So the parents made her get married. And we have the data that show that young women who get married have very bad economic outcomes, very bad educational outcomes, often subject to abuse. Her life was wrecked. So it turns on assumptions. The assumption was that Saudi Arabia has all these child marriages. Actually, in the United States, it's worse. People didn't know that. We make assumptions. And then Kiefer has to make a decision. He promises his daughter he's going to talk about it. And Julie White, who plays his campaign manager, says, you can't talk about this. So he wrecks his relationship for a while with his daughter because he promised her he would do something, and he does what's best for his campaign because she says, there are a lot of states that aren't going to be happy with you. Don't do this. So this is about him. Can he be ethical? How does he live his life running for office? So this was an element, or this was an policy issue, this was a social issue that I could draw on doing a lot of research. Dawn DeNoon wrote the episode. She's an amazing writer. And it was really powerful because we can relate to it. Like, should the states be allowed to decide that? Should kids, mostly young women, get married under 18? But there are states like New Jersey, Delaware, several others now that have passed laws that you can't. And you need a parent's permission. You need a judge's permission. Even in some states, there are some old laws. I think that you could even be 11. It doesn't happen, but you can be 13, 14, 15, 16. Is that what we should do?
Just how powerful can a TV show be at shifting narratives or even influencing legislative changes? One particular episode of Law & Order SVU sheds light on an issue that wasn't receiving the attention it deserved at the time. And that was the backlog of untested rape kits across the United States. The episode used a combination of medical facts, personal stories, and diverse experiences to showcase the real-world impact and inspire action. After this episode aired, it fueled public discourse and led to a wave of changes.
It's a lot about being open to stories. I'll tell you one last story, which is I was at an event for Mariska. She has a foundation called the Joyful Heart Foundation. And I sat next to a young woman who hadn't been out of her apartment for a year. And I said, why? And she said, well, she was sexually assaulted and she found out they didn't open her rape kit. And I said, oh, this is a kit that takes 5 to 7 hours of very scrupulous work to find any DNA, any fiber, any hair for evidence. So I started doing research and I found out this was in 2010, tens of thousands of untested kits. That's kind of weird because often these perps are in the system for having done it before or doing other bad things. So that became an episode with Jennifer Love Hewitt. That became Mariska's passion project. She did a documentary called I Am Evidence about it, and she's testified, I've testified, we've written articles. And so we did this episode about a young woman who hadn't had her kit open, and Mariska starts to find out 10,000 untested kits in Detroit, 5,000 in Birmingham. And so we gave people actionable steps that they could take after they saw the episode. They could go online and they could get a kit, their own kit, to go to the chief of police in their community or their different, depending on the city, it could be their city council, to demand that the kits be opened and tested. Because in the episode, it turns out, when they do test her kit, that he's raped all these other women. And it would have stopped if these kits were tested. Now, since that episode, there are a number of states that have cleared the backlog, and there are a number of states that have made it a law that every kit has to be tested. Is that every state? No, it's not most states. Is there a law languishing? Is there a bill languishing in Congress that Mariska has really worked on? Yes. Will they do anything about it? I don't know. I hope so. But you see what happens in Congress. Here's an example of something that's really bipartisan. And this is bipartisan completely. And why hasn't it been brought up instead of all the nonsense that gets brought up? This is something that will change people's lives and will make them less fearful of going out again. So that's where a story can have real, what we call legs or life.
What happens when TV doesn't quite get things right, or when there's challenges adhering to factual correctness? Whether it's due to logistical challenges, or it fits in service of the bigger story. Dr. Baer reflects on a particular instance when portrayals in the TV show ER received feedback from the New England Journal of Medicine, which criticized the portrayal of common medical procedures utilized in the show. These critiques have driven subsequent episodes and other TV shows to adapt more realistic portrayals over time.
I want the information to be accurate because why do we take so much effort and energy to put people in scrubs and make it all look real if we're going to tell things that are more melodramatic? Because people believe it. We want them to believe it, so we better be accurate. And so I wanted to know, how much do people really take from our shows? Because we had been chastised after the first year in a piece in the New England Journal of Medicine, the gold standard, and it was a piece on cardiopulmonary resuscitation that was done by researchers at Duke. And they had called me and they had said, hey, can we get all your episodes? We really like them. And then they wrote this piece that was damning and said, ER, Chicago Hope, and Rescue 911 show CPR working way, way, way more frequently than it does. And they don't show what we call the sequela or the bad side effects. I argued, I got to write the response, and I said, okay, you have a point, but your data is really off in the sense that you have Rescue 911, which is always positive, it's called Rescue, and you equate different events equally. So for instance, if we spend an episode talking about should we do it or not, should we use the paddles, or we just use the paddles, that's two different ways of telling the story. And so, but you equate them equally, that's, as a positive outcome, that's really biased. But I did say they have a point, and we addressed it. And we made Noah resuscitate someone, and he breaks his ribs, and it's bad, but he gets a pulse back, and he's like, yeah. And Juliana's like, oh my God, should we have done this? So I think that was fair. And this is right, when we were, this was only the first year. So we really tried to be accurate. Do we get results back more quickly? Yes. Are we jumping time? Yes. It's not like, 1 hour, like 24, like this is from 10 a.m. to 11 a.m. So we do jump time. And, but we don't make up like CPR is used for arrhythmias, not for like, something, like your heart has a bullet in it and you don't have an arrhythmia, it's just stop. So it's like you can do CPR, but you don't do paddles. So so we did, this really had an impact. And I wanted to know, do people really believe what they're seeing on our show? Because we better be accurate if they do.
TV dramas are well known for tugging at our heartstrings, making us laugh, making us sad, making us cry, and leaving us confused at times. But we're a public health podcast, and we wanted to know, is there any evidence base behind TV shows being an intervention that can influence health attitudes, beliefs, knowledge, and outcomes? Dr. Baer shares a first-of-its-kind study conducted in 1997, which analyzed the viewer's knowledge about HPV and cervical cancer before and after watching an episode of ER on the topic. Even he was left a bit surprised by the results.
So I worked with the Kaiser Family Foundation, and we got money from them to do a study, and we wrote an episode about HPV and cervical cancer, and we also wrote one about the morning after pill, which that was in 2000. Here we are in 2024 at the end of 2024, and hey, we're still debating two things. One is the morning after pill. The Texas Attorney General just sued a New York doctor for sending those pills to Texas. And HPV, we have Gardasil now. We didn't have the vaccination then, the vaccine. Now we do, but a lot of people are not taking it. So we surveyed about 1,000 people on their knowledge of HPV. HPV is a virus. We do know definitively it causes cervical cancer. It is one of the cancers that can be prevented. How? Condoms. That's not the best way because HPV can still be prevented through having the vaccination, HPV vaccination, or not having sex. So we surveyed people, and we also asked them questions about, how often do you go to the doctor after you see ER? Who's your favorite, characters? What's your favorite storyline? Things like that. So we were shocked. I think 20% knew HPV caused cervical cancer. This is in 2000. Hopefully more people know now. After the show aired, we did not tell people to watch the show. We just were drawing on subjects who said that they had watched ER 2 out of the last 4 times it was on. So they were frequent watchers. And the treatment was the episode. And then we resurveyed a random sample of viewers. So it would be the same as what we did before. And 60% knew. So we had 25 million viewers. That's 15 million people. That's a lot of people. Now, you don't have that many viewers on any show anymore, but still, even if you change one person. So we were like stunned. And also 1 out of 7 said they had gone to a doctor after something they'd seen on the show. And they said that their favorite storyline at that point was the Gloria Rubin HIV storyline. Someone having HIV and being accepted, respected, not feared. And that's what that was about. So by giving that character HIV, we could do her personal journey, but also this journey that doctors and healthcare providers, nurses were facing who were HIV positive and weren't allowed to come back to the hospital because the research wasn't definitive. We didn't know enough then, but we were learning pretty quickly. And so we wanted to get into that. And so that study was published. People can look at it in Health Affairs in 2001. And that was the first study, to my knowledge, that looked at the impact a show could have doing an experimental study as opposed to a retrospective, asking people, do you remember, HPV on ER? That's not an experiment. Since then, there have been many studies done, particularly at University of Southern California in the Norman Lear Center. The late, great Norman Lear gave money to start this center at the Annenberg School, which is where HollywoodHealthAndSociety.org is. And they have amazing work that they're doing, not just with giving people, writers, information that's accurate, but also, putting out information on really like tough issues like abortion and things like that. So they're a great organization for accurate information. So that was the beginning for me of really like saying we have to be accurate. I mean, it was before, this was in 2000 and ER had already been on for 6 years, but it was really where I saw experimentally what we are doing. And that's why I think also there are always doctors on every medical series now, doctor writers. You name the show. My friend from medical school, David Foster, wanted to be a TV doctor. He's an internal medicine doctor. And he was the doctor, writer, producer on House. And he's the doctor, writer on New Amsterdam. And he came through, I gave him shows to write and worked with him because he said he wanted to do that. And so he's another doctor writer. Harvard has kind of cornered the market. The show, The Resident, had 2 physicians from Harvard on it. As I said, House, ER, New Amsterdam. Grey's Anatomy has Zoanne Clack, who's an emergency physician. She's been on the whole time. Grey's is a different show from ER, so it's much less medicine and much more soap. But we had certainly our share of soap on ER.
As we wind down this episode, he ends by discussing the evolving nature of science and medicine, emphasizing that while science may not always provide definitive answers, it builds on cumulative knowledge, much like how medical narratives are constructed for television.
So that experiment is really important. And I think now it's going to be interesting to see with the Trump administration coming how medical series deal with these issues if RFK Jr. makes it through. I think he's desperately ignorant on topics like vaccination, but on topics like high fructose corn syrup, he's on spot. We know there's a huge study that Harvard's Chan School of Public Health just put out, 100,000 people who drink 1 soda a day, 1 soda, sugar, sweetened soda, high fructose corn syrup soda, have an 18% increased risk of cardiovascular disease. Why is that? Because high fructose corn syrup is processed by the liver, which increases triglycerides, which are not good for your heart. So we know people who don't drink sodas have a much, lower risk. And if you drink 2 sodas a day, it goes up to 20-something%. That's a new study that just came out. And that's apart from as much physical exercise as you do. So we're getting, now, did we know this 10 years ago? No, we didn't know it about the exercise because Coca-Cola and Pepsi say, it's a part of a balanced diet and exercise. So this is really important. So, there are data out there, and the soda companies, I teach this at Yale, a soda politics course starting in January, where you can find studies, and I make my students do this. They have to find studies that show that soda consumption harms health. There are a lot of studies out there that show it can increase, type 2 diabetes risk, et cetera. And some have to find studies that show there's no impact. And guess what? There are studies out there. What do you all think about these studies? Let's really look at them. What do they have in common? Well, they're from several universities. They're from the University of Colorado and South Carolina, Louisiana, and West Virginia. Who paid for these studies? Studies are expensive. Oh, the ABA. What's the ABA? The American Beverage Association. What's that? Oh, that's the lobbying group for the soda industry. Who paid for all these others? NIH, foundations. How is it that every study that shows soda has no risk is sponsored by the soda industry? And my students are like, whoa, this really screwed up. Yeah. Now, because of things like this, for peer-reviewed journals that are valued and we know that are scientifically as accurate as one can possibly be, demand that conflicts of interest be stated. Now, there are all these organizations, and you have to know what the organizations are and look them up. And then my students do that, and they're like, oh my gosh, this is like a science organization that's funded by, highly processed food companies and the soda industry. And now we're having more and more data on highly processed food. Is that related to the increase in colorectal cancer in young people? So, as I said, science is not definitive. It is accumulative, and we work based on previous work. That's where we want the previous work to be accurate. We want it to be trustworthy. And AI is helping us in some ways by looking at what studies have been questioned and things like that. So it's important to have an empirical basis.
What you heard in this episode is an in-depth look at how medical dramas influence public discourse, shape societal norms, and lead to legislative changes. It underscores the responsibility of TV creators to provide accurate, well-researched information while maintaining the compelling nature of their narratives. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.